The testing of the 38 people who have been asked to quarantine as part of contact tracing related to Grenada's 31st and 32nd COVID-19 cases is expected to start on Friday. Those persons are believed to have come into contact with a medical doctor and his wife who arrived in Grenada from the United States a week and a half ago. Friday marks 1 week since their possible exposure to the deadly virus. The couple breached home quarantine rules and reportedly visited 4 restaurants in the south of the island between Friday and Saturday night before receiving the results of their PCR tests. This development has sparked heated discussions about the efficacy of the Health Ministry's ability to monitor people who are allowed to quarantine at home. Some have also questioned why the American doctor and his wife were permitted the privilege of home quarantine when some Grenadians are kept in state-supervised facilities for which they must pay a fee. The case of newspaper publisher George Wurm being denied the request to home quarantine about 2 months ago has been brought to the fore as a case in point. Also at issue is whether the tracking watches which were promoted as part of the supposedly effective monitoring system have been deployed. The question was put to Health Minister Nicholas Steele.
A GPS device was not placed on the individuals at the airport. All other protocols were followed at the airport, but the GPS device was not placed on the individual at the airport. It was not from any waiver or instructions from the Ministry of Health, nor did the Ministry of Health know that this individual did not receive a GPS device.
Minister Steele says that his ministry continues to face challenges as it relates to persons' non-compliance with quarantine protocols.
Some individuals are going out of their way to breach the system, or are not taking our rules and regulations that have been put there to protect us, not taking them seriously. Not just visitors, but we ourselves running establishments here in Grenada, trying to carry on our livelihoods. Some of us are breaching the rules and regulations and putting the rest of us at risk. The Ministry of Health will do its best, and the government and with the RGPF its best to enforce. But we should not have to be spending so much of our resources on enforcement.
Most of Grenada's 32 COVID-19 cases have been imported. There was a low while the country was on lockdown, but the number have been risen since the reopening of the Maurice Bishop International Airport and other ports of entry. During the month of October, 2,800 people arrived on the island. The Health Ministry has administered more than 7,500 PCR tests since March. For GBN News, I am Rina Pear reporting.